the present study was undertaken to compare the effects of yogasanas performed with props and without props on flexibility levels among IT professionals. So the problem identified through the previous research studies is that the IT professionals who happen to lead a sedentary lifestyle suffer from musculoskeletal stiffness, reduced joint mobility, and increased risk of chronic pain. This in turn might have a great impact on their function and affect their work productivity. The solution to this problem is flexibility, which significantly influences overall musculoskeletal health, posture, thereby it improves functional performance. There is no doubt that the yoga practice will improve flexibility and physical well-being, but the effectiveness of yoga practice may vary depending on the use of supportive tools that are also called as props. Props helps to maintain correct posture. It gives a proper and deep stretches and reduces the risk of injury. Coming to the introduction, flexibility is the ability of a joint or series of joints to move through its full range of pain-free range of motion, and it depends on elasticity of muscles, tendons, ligaments, joint structures, and the neuromuscular coordination. It is required for an efficient performance of daily activities, sports, and occupational tasks. Flexibility enhances posture, reduces muscular tension, and it improves circulation and supports overall musculoskeletal health. Sedentary behavior, coming to the role of lifestyle factors on body flexibility, this sedentary behavior shortens and tightens the muscle over time and decreases the range of motion in the joint. And prolonged sitting tightens the hip flexors, hamstrings, lower back muscles, and results in restrictions in the shoulder girdle. Poor posture also causes tightness in the muscle, especially in neck, shoulder, and lower back. Muscle fatigue is a condition where there is reduced oxygen delivery to tissues, interfering with collagen synthesis, which in turn leads to reduced tissue elasticity, these are caused due to stress, poor sleep quality, lack of sufficient water and micronutrients. The statement of the problem is that the IT professionals are exposed to prolonged sitting, repetitive computer work, and reduced physical activity, which in turn contribute to decreased flexibility and musculoskeletal discomfort. Yoga is widely recognized as an effective method for improving flexibility. However, different approaches to yoga are used, including asanas performed with and without props. Although yoga props are commonly recommended to improve alignment, comfort, and accessibility, there is limited scientific evidence comparing their effectiveness with traditional yoga practice without props. The lack of comparative research creates uncertainty regarding the most effective approach for improving flexibility among IT professionals. So the research problem statement is there a significant difference in the effectiveness of yoga asanas performed with props and without props on flexibility levels among IT professionals? The aim of the study is to investigate and compare the impact of asanas with and without the use of props on flexibility parameters among IT professionals. My objectives are the primary objective. The first one is to evaluate the effect of asanas with props on flexibility levels. And the second one is to evaluate the effect of asanas without props on flexibility levels in IT professionals. The secondary objective is to compare the effectiveness of asanas with props versus asanas without props on flexibility level in IT professionals. Hypothesis: there will be a significant improvement in flexibility levels among IT professionals after practicing asanas with props. There will be significant improvement in flexibility levels among IT professionals after practicing asanas without props. The third one is asanas practiced with props will produce significantly greater improvement in flexibility levels compared to asanas practiced without props among IT professionals. Coming to the literature review, in 2023, a researcher called Nidhi Sharma did a survey in 563 professionals in South Bangalore using the Nordic questionnaire and found out that 34.2% are reported to be having neck pain, 35.5% reported upper back pain and 37.3% complained of lower back pain. So in 2022, another researcher called Xingpo, he applied an integrated yoga mindfulness meditation program along with physical exercise in 80 computer users with chronic low back pain, and found out that there was a significant reduction in pain, which was measured using NRS scale, numeric rating scale, and the disability was also decreased. And this was measured using Oswestry Disability Index, and greater improvement was seen in spinal flexibility, which was assessed using sit and reach as a test. And in 2025, a research conducted by Shiva Jahani, who examined the use of props in undergraduates, and found out that the prop usage helped the participants to achieve more difficult poses and supported balance and flexibility. So the gap identified in these studies was that there were no studies that compared the asanas with and without props in IT professionals with measurable outcomes. And the justification of the present study is that the present study will directly address a population known for flexibility deficits, improving the practical value. Coming to the methodology, the study design is a comparative experimental study with a pre-test and post-test design. The study period is 12 weeks, 3 sessions per week, 45 minutes per session, and the sampling method is purposive random sampling. Sample size was calculated using finite population correction method with adjustments for eligibility, consent, and expected accretion. The step-by-step calculation is given here. So considering 97 employees, it has been calculated step by step and rounded off to 46 participants, and informed consent was obtained from all the participants of the company, and the participants were given choice to withdraw whenever they wanted. And the inclusion criteria were they must be IT professionals, they must be healthy adults, and the age range is in between 31 to 35 years, and they must be willing to participate in the study. Exclusion criteria. There must be no history of musculoskeletal injuries. There must be no chronic illness that restricted that might restrict asana practice, and they should not be a regular yoga, gym, or gym practitioners, or they should not be enrolled in any flexibility program. And pregnant women are also excluded from the study. So once 46 participants have chosen, they were randomly allocated into 2 groups. The first group is without props group, that is group A. They used props, and the group B, they did not view, the first group did not use the props to perform the asanas, whereas the second group used prop for practicing the same asanas. Initially, pre-test was done before giving the yogic intervention, and post-test assessment was also done after the 12 weeks intervention of yoga. So, so these are the independent variables. So in this picture, there are I have given the pictures in pair. In this, the first picture from each pair shows the asanas practiced with the props, and the second picture is the asanas practiced without props. So I gave Sukshma Vyayama for 8 minutes, asanas for 22 minutes, pranayama for 5 minutes, and relaxation for 10 minutes. And I gave Trikonasana, Parivrita Trikonasana, Padahastasana, Ardha Hanumanasana, Parigasana, Gomukasana, Baddhakonasana, Ushtrasana, Paschimottanasana, and Sarala Matsyasana. My dependent variables are shoulder, upper back, and hamstring lower back flexibility levels, which were measured through Apley's back stretch test and sit and reach test. So these are the flexibility tests that I have used. First one is Apley's back scratch test. It measures the shoulder flexibility and upper back reach. The equipments needed are ruler or measuring tape. the participant has to will be standing straight and extending one arm from above the shoulder, and the other arm will be extended from below the shoulder. The person has to is asked to touch or overlap the fingers according to their capacity, and the distance is measured. The test is done with the other arm up, and the test was repeated thrice, and the best score was recorded in centimeters. So if the fingers overlapped, it is recorded as a positive value, and if the fingers just touched, it is recorded as a 0. And if the fingers did not meet, then it is recorded as negative value. The second test was the sit and reach test. It measures the trunk, lower back, and hamstring flexibility. And the equipment is wooden box with a scale placed over it. The patient has to sit on the floor with a leg extended and touching the box, and the one hand is placed over the other, and the participant is asked to move forward as much as they can, and the test was repeated thrice, and the best score was recorded in centimeters. So we are seeing the concert chart for participant flow. Initially, 52 participants were enrolled for the study, and they were assessed for eligibility, where 6 were excluded from the study since they did not meet the inclusion criteria, and 46 were included into the study, and they were randomly allocated into 2 groups, without props and with props group, and these 2 groups were tested for flexibility using the sit and reach and back scratch test, and they were given 45-minute sessions for weekly thrice for 12 weeks, and once after completion of this 12 weeks program, they were assessed again with the same flexibility tests, and the values were recorded and statistically analyzed for pre and post test comparison, and also with and without props group comparison. So these are the results of the demographic data. Here it compares the age between the 2 groups, the with props and without props group. Here the mean and standard deviation was calculated for age and gender to see how they are distributed, and the minimal difference in the mean values, which is 0.08 years, suggests that participants in both the groups were nearly identical in terms of age. As you can see here, it is just 32, and here also 32. Is just difference is just in points. And although there is as you can see here, I have given number 1 for female and 2 for male and calculated them statistically. And there is a slight variation, although there is a slight variation in gender composition between the groups. The standard deviation, as you can see in the table, is 0.50, which is same for both the groups. And this suggests that there is a similar level of dispersion within these groups. The results of sit and reach test. So this is table, we will see the table 1 first. Here, you can see this post-test mean in this column. We can see how the reading is significantly high. In the post-test mean is significantly higher than the pre-test mean of both the with and without props group. Coming to table 2, we can see that the mean difference T value and Cohen's D value are highly significant in the with props group compared to the without props group, which is seen in this second row, and this is the difference, comparison difference, which is given in the third row. This indicates that the intervention with props has produced a substantial improvement in flexibility performance. And the bar diagram, and the same is represented in the form of bar diagram, and which suggests that the inclusion of props enhanced the effectiveness of flexibility training program, resulting in greater gains in the performance. So this page shows the results of Apley's back scratch test for left shoulder. In table 1, we can see that the post-test mean is very high than the pre-test mean, for both with and without props group. And coming to the table 2, here also the mean difference t value and hence d value are higher than the without props group. The with props group shows a higher value than the without props group, and for all the tests, the p value is very highly significant. That is, it shows lesser than 0.001 as a value, and the say bar in the lower part we can see the bar diagram which depicts the same. The blue bar is taller, and we have to compare this blue bar with the without props group, which is showing the t test. The orange bar is showing the coherence d test. The same, whatever we have shown in the tabular column is being represented here. And this shows that from both the statistical and practical significance perspective, the findings strongly support that using props was more effective than performing the intervention without props for improving Apley's back scratch test for left shoulder performance. This shows the results of Apley's back scratch test for right shoulder performance. And in this, the table 1, we can see that post-test mean, again, it shows a higher value when compared to that of the pre-test mean in both the with props and without props group. And table 2 shows mean difference t value and coherence d value to be highly significant in the with props group than the without props group. So indicating a larger improvement in right shoulder flexibility after intervention with props. And the same is represented in the bar diagram. From both the statistical and practical significance perspective, the results strongly indicate that using props was more effective than not using props for improving right shoulder flexibility also and the upper limb reach. So this page shows the comparative chart of the mean difference of all the 3 tests. All the blue bar shows the with props group. As you can see, when compared to the without props group, it is highly significant, shows highly significant value than the other group, without props group. So coming to the discussion, the present study demonstrated that both yoga with props and yoga without props significantly improved flexibility levels among IT professionals following the 12-week intervention. Improvements were observed in both the sit and reach test and Apley's back scratch test, indicating enhanced flexibility of the hamstrings, lower back, shoulders, and upper back. The findings revealed that the participants practicing yoga with props showed greater improvements in flexibility compared with those practicing yoga without props. The possible reason would be that the use of props may have facilitated better postural alignment, improved safety, reduced strain, and enabled participants to maintain stretches more effectively and for a longer period, thereby contributing to greater gains in flexibility. So comparing the present study with that of the previous study, so all the first 5 papers and the findings reported a significant improvement in flexibility and hamstring flexibility and physical fitness, and then musculoskeletal function have been improved, mobility has been improved, and physical performance in adults with movement limitation have been improved. So we are seeing increased flexibility after the intervention of yoga in the previous studies by Trans et al., Cohen Adams, Amin Goodman, Tellis et al., and Zhang et al. This is in line with the present study. So the current study is also supporting the same, where we have seen both the yoga with props and without props have significantly improved flexibility among the IT professionals after giving a 12-week of yogic intervention. So the last one was a study done by Iyengar ji in 2005, which suggests that Yoga props facilitate proper alignment, accessibility, and safe execution of postures, particularly for individuals with limited flexibility. And this also is supported by our present study, where we got the result of greater improvement in flexibility compared with those of practicing without props when used in comparison with the props group. In conclusion, the present study investigated the effect of yoga asanas performed with and without props on flexibility levels among IT professionals. And the findings strongly revealed that both interventions were effective in improving the sit and reach hamstrings and lower back flexibility by app-place back scratch test for right and left shoulder performance. And the intervention performed with props were clearly more effective than the intervention performed without props. This suggests that props play an important role in enhancing the depth, safety, and efficiency of asanas. Although yoga without props was also effective, its impact was comparatively lower than the effect of with props result. So the results support all the stated hypotheses of the study. The findings highlight the importance of incorporating props in yoga practice, especially for individuals with limited flexibility. Therefore, it can be concluded that the inclusion of props enhances the effectiveness of the flexibility intervention and leads to superior improvement in the lower back, hamstring, shoulder flexibility, and upper limb reach. Recommendations. Prop assisted yoga is recommended in workplace programs. Use of props is recommended for sedentary, beginner, and low level flexibility in individuals. Periodical assessment of flexibility using simple tools like sit and reach test and back scratch test to track improvement and adjust training program accordingly. Regular and consistent practice should be emphasized rather than intensity, ensuring gradual and sustainable improvement in flexibility. The study limitations are: the study was conducted with a relatively small sample size, which is 46 participants, which may limit the generalizability of the findings. Participants were recruited from a specific occupational group, that is IT professionals. Therefore, the result may not be applicable to other populations. The intervention period was limited to 12 weeks and long-term effects on flexibility were not assessed. Only flexibility variables, that is sit and reach and app-place back scratch test, were measured. Other physical and psychological outcomes were not evaluated. Future directions. The future studies may include larger sample size in order to improve the generalizability of the findings. Similar research can be conducted among different populations such as students, office workers, healthcare professionals, and older adults. Long-term follow-up studies are recommended to examine the sustainability of flexibility improvements, and future investigations may assess additional variables such as strength, balance, posture, stress, quality of life, and musculoskeletal pain. These are my references. I thank Dr. Jayanti Madam and Dr. Natarajan Sir for guiding me throughout my project. These are some of the photographs taken during the practice.